Hi, my name is Nydia Pendlein. I'm the director here on our orthopedic spine unit at Southern Hills Hospital. I would like to welcome you to our hospital and ensure that you have the best experience. During your stay here, a nurse leader will visit with you and spend about 5 minutes talking to you about your overall experience. And our nursing staff will check on you every hour. My role here is to be a resource to you and the staff during your healing process here. Thank you for choosing Southern Hills Hospital, and if you have any questions, please feel free to contact me.
Welcome. This is Southern Hills Joint Replacement Education class. My name is Beth Pangonis. I'm an RN here on the floor at Southern Hills, and I'm also the nurse educator. We're here to teach you about joint replacement. We have this class for 4 reasons. To reduce your anxiety, you're having surgery. It's scary. That's why you're here in class. Reduce your risk for infection, reduce your risk for blood clots, we call them DVTs, and reduce your risk for falls. Everybody has questions. We're going to try and answer as many questions as we can for you in this class. If you have questions that we don't answer, write them down, bring them with you so we can answer your questions before you have your surgery. And when you have questions, if you get them answered, you reduce your risk anxiety. Your anxiety is reduced, you're going to have a better outcome with your surgery. You have a lot of people here taking care of you during your surgery. You're going to have nurses, you're going to have pharmacy. You're never going to see the pharmacist, but they're here taking care of you. We have environmental services, we have food services, we have doctors, we have pharmacy technicians, we have CNAs. We are color coordinated. The nurses wear royal blue. You'll see us on the floor. I'm not in royal blue. We also are identified with badges. The nurses all have a big RN on our badge, and we should be introducing ourselves when we come into your room. If we don't introduce ourselves when we come in, ask who's in to take care of you. Make sure that people are identifying themselves when they come to take care of you. You need to know who's taking care of you. Also make sure whoever comes in to take care of you, if they're touching your IV or your wound, that they are washing or sanitizing their hands. We have in the hall and in every room a sanitizing station to help keep their hands clean. That's one of the best ways to prevent infections. Make sure people are washing their hands and that you are washing your hands after you use the bathroom, after you eat. That's the best way to prevent infections. That's one of our goals, to prevent infections. You just had surgery, you're at a high risk for infection. Valuables. You are responsible for your valuables. Things like computers, laptops, phones, jewelry. You can bring them with you, but you're responsible for them. The hospital does not take responsibility for them. The pre-admit process starts today. You've already talked about having surgery with your doctor. That's why you're watching this video. That's why you're taking the class. You're learning about what's going to go on. Approximately 3 days before you have your surgery, you're going to come in, you're going to have your pre-admit labs, you're going to have EKGs, you're going to have blood work, you're going to have x-rays. All of that is ordered by the doctor who's taking you to surgery. They're going to be taken care of by the doctor who's doing the surgery and your primary care physician. Bring all that information with you when you come to be pre-admitted. You can start that process about 3 days before you come in to do your surgery. The pre-admit process can be started online. It can be started up to 3 days before you have your procedure. You can also come into the hospital to do that. The office is open 5 a.m. to 5 p.m. Monday through Friday. The online process is you go to southernhillshospital.com. When you do come in to do any of your processing, you need to bring picture ID, your insurance card, and your form of co-payment. They can take care of your co-payment while you're here doing your pre-admit process. Also, any advance directives that you have. Advance directives have to be on your chart for us to honor them. We want to honor what you have. So if you have an advance directive, power of attorney, those kind of legal documents, bring a copy of them with you so we can put them on your chart and get them taken care of. 1 week before your surgery, you should have had a discussion with your primary care and your surgeon about the risks and benefits. Ask questions, write your questions down and get them answered. Also, you want to take care of any pain control issues because you're going to have to stop taking any pain medications called NSAIDs, which are medications like Motrin or naproxen. You have to stop taking those because they interact with your clotting mechanisms. If you have to have some pain medications, your doctor's going to need to order something for you. You want to have that taken care of. A day or two before you have surgery, you're going to get a call from the pre-op nurse. They're going to ask you about your physical history. They're going to ask you about your medication list. Have that list handy. Make sure it's complete so we can make sure that we have all of the medications that you take in our computer system. Make sure that they're complete and it's proper. The evening before you have surgery, we want you to take a shower. Pay special attention to your hair. You're not going to be able to wash your hair for 2 or 3 days. We want to make sure that you feel comfortable when you are here in the hospital. So make sure your hair is nice and clean. You're going to take a shower with antibacterial soap. You do not have to go get a very fancy one. Any soap that says antibacterial on it is fine. Pay special attention to the area that you're having surgery on. If you're having surgery on your hip, make sure it's nice and clean. Do not scrub it with a loaf of sponge or a scrub brush. Those put tiny holes in your skin. Those are openings for bacteria to get in. We don't want any extra areas for bacteria to get in, put you at risk for infection. We don't want any extra risk for infections. You're going to stop eating and drinking the night before surgery. That means no mints, no gum, no cigarettes, no throat lozenges, nothing. If you are a smoker, let us know so we can get a nicotine patch for you. We are a non-smoking campus. That means no cigarettes, no e-cigarettes, no chewing tobacco on the campus at all. And that's for visitors as well. You're going to come in. The nurse will, or a CNA, will meet you in the lobby. They'll finish the pre-admit procedure. When you come in the front doors, the admit area is to the left. All the OR area staff wears dark blue scrubs, so you will be able to recognize them. They will double check your name tag and they'll put your ID on. Make sure it's correct. If you wear cheaters like I do, make sure that you read your ID band and that the spelling's correct and that the numbers are all match up, because sometimes it's hard to see. They're very small letterings. The parking lot is across from the hospital. You can drive into the circular area. The pre-op staff will come and get you. That's where you're going to double check your ID and make sure it's all correct. Your family member can stay with you the whole time, right up until they take you into the operating room. They're going to get you into a gown. They're going to start an IV on you, and they're going to put stockings on you. We call them TED hose. They're also going to put something on you called an SCD. It's called a sequential compression device. It Velcros on your lower legs, and it helps prevent blood clots. This is one of the things I was talking about to prevent DVTs or blood clots. It's very important that you wear these as much as you can throughout your hospital stay. The biggest thing to remember about this product is it connects you to the end of the bed. So after your surgery, when you get up, you're connected to the end of the bed. You're going to try and get up, and you're going to be connected. You're going to take 2 steps, and you're going to face plant, and you're going to fall. You're going to injure that new knee or hip. So whenever you feel the need to get up, when you need to go to the bathroom, you want to get a drink of water, you just want to sit up in the chair, call for help. Ask the nurse or the CNA to come and help you. We don't want you to fall. We don't want you to injure that new knee or hip. Leave extra stuff at home. The more stuff you have, the more stuff you're going to take home. If you have a walker or a cane, leave that at home. If you have a walker at home, bring it with you the very last day that you're here. Physical therapy can fit it to you. They want to make sure that it's the correct kind of walker and that it fits correctly. If it's not the proper walker, they'll make sure that you get the correct one to take home with you. So in the hospital, when they bring you in, the pre-op nurse will take you back to the OR area, or the pre-op area, excuse me. We refer to it as the PPCU, which is the pre-procedure area. A reminder here, we often use acronyms that you don't understand, and I apologize for that. We sometimes forget that we speak a different language than you do. If we say something that you don't understand, let us know so we can correct ourselves and let you know what we're saying. We're going to change you into a hospital gown. We're going to start an IV on you. We're going to probably write on your body that this is the correct hip, this is the wrong hip, so the doctor knows which site we're doing surgery on, or your knee. The family will be escorted into the surgery waiting area, and they can follow you. You're going to get a code that's a 4-digit number that lets your family member know where you are. While you're having surgery, you have anywhere from 5 to 10 people taking care of you. You have the anesthesia. You have your surgeon. You have a physician's assistant. You have a scrub nurse. You have an OR nurse. You have a surgical tech. And you have a circulating nurse. Plus, you probably have 3 or 4 people that are in there that I don't even know about. There's a lot of people who take care of you during surgery. When you're done with surgery, they take you to a post-op area called PPC or PACU. While you're in PACU, or the post-op area, recovery room, they monitor your vital signs. They get you comfortable, monitor your breathing. When you're stable, that's when they call our floor and let us know that you're ready to come up to us. It's kind of frightening when you wake up in there. You have oxygen on your face. You have an IV on your arm. There's lots of bells and whistles going on. There's just a curtain between you, and there's a lot of people down there. You're also going to have your SCDs on, those sequential devices squeezing your legs. It's kind of a frightening area, but when you remember that, oh yeah, Beth said I'm going to be in here. It's going to be noisy. It's going to be scary. It's not near as bad. Once you get all stable there, the nurse gets your pain under control, you're breathing well, that's when they come up to our floor. They're going to call up to the charge nurse, and they're going to say, I have a patient ready for you. When there's a nurse and a room available, that's when you come up to our floor. If there's not a nurse available or a room available, sometimes you stay down there a little bit longer. It's not always the funnest thing for you, but it's the safest place for you. So if you stay down there a little bit longer than you anticipate, it's because they're trying to keep you as safe as possible. You'll come up to my floor, or our floor. It's on the 5th floor. It's the ortho spine unit. It's a newer unit. We opened in April. It's all brand new. Most of our nurses are orthopedic trained. They have 30% of our nurses have trained specifically in orthopedics. They have a certificate. They've trained extra in orthopedics. The rest of us are all trained in orthopedics, so we all know how to take care of orthopedic patients. When you meet recovery room criteria, you'll be transferred to a room on the orthopedic floor. Once you get up to the orthopedic floor, you'll still be a little bit groggy. You'll still be sleepy. Sometimes you're a little dizzy. We'll manage your pain. We'll keep you as comfortable as possible. Sometimes you're a little nauseous. That's all very normal. We believe you when you tell us you're in pain. Please let us know. We want to keep you comfortable. It's kind of scary. That's why we're here. That's why you're here taking this class, to relieve your anxiety, get your questions asked. It makes it a lot easier. You'll be happy when you're all done with this whole process. We want you to be safe, so always use your call light. Up on our floor, like I said before, it's a relatively new floor. Everything's new, everything's nice and clean. All the rooms are single rooms. They all have showers, they all have bathrooms. Visiting hours are not limited. You can come 24 hours a day. We do discourage large groups of people, only because it gets noisy and there's other patients on the floor. We want everybody to be able to heal in a nice, quiet environment. We have available on our unit a very special feature here. We have a physician's assistant. Her name is Dar Stone. She is ours just for our floor, and she helps our staff manage pain and nausea and other health issues we have with our patients. She is connected with all of our orthopedic and our spine surgeons, so we don't have to try and call them during the day and get special orders. If we have a pain issue, I can go directly to her, and she can work directly with the patients to get their pain managed quickly, get their nausea managed quickly. It's been a really, really good benefit for our floor. So if you have any questions for us, let us know. We can get things taken care of rather quickly with Dar.
My name is Dar Stone. I'm a physician assistant, otherwise known as a PA. I function as a clinical coordinator here on the ortho spine floor at Southern Hills Hospital. My role is to be your advocate and act as a liaison between you and your surgeon. Oftentimes there are more immediate needs that need to be addressed here on the floor, and I'm on site pretty much all the time, Monday through Friday. Oftentimes there may be some pain management issues that need to be addressed immediately rather than wait until the surgeon or his or her PA makes rounds. and I can put orders in so that those needs get addressed immediately.
A blood clot is a collection of coagulated blood. They usually happen in your calves, right back here, and it's from the blood pooling in the back of your leg. The best way to prevent them is to do foot pumps. You just move your foot up and down. It's a very easy exercise. It keeps the muscle moving. It helps the blood go up your leg, and that's where the blood clot happens. The compression devices squeezes that, and it helps prevent them. The stockings do the same thing. Sometimes doctors will give you a medication to help make the blood a little bit thinner, and it's an injection or a pill. There's a lot of different medications they use. Your doctor will decide which medication to use for that. And activity is the best way to prevent blood clots. Keep your SCDs on and keep your tights on. Pain management is a big, big issue. You're gonna have pain, you just had surgery. We believe you when you tell us you had pain. Most of you have pain right now, that's why you're having this joint replaced. If we can keep you at your pain level now, which is probably for most of you, between a 4 or 5 on a scale from 0 to 10, we're doing a good job. Ask us for pain medicine. We have IV pain medicines available, and we have pills available. We also use ice, and we also use a product called AscendaWave. It's a diversion activity. It's a tablet that has music, it has movies, it has a lot of different things on it available that helps get your mind off of your pain. Ice is one of the best products that we can use. It does not have complications except for that it's really cold. It can cause a skin burn, which the best way to prevent that is to have a pillowcase or a towel between your skin and the ice. We have a product here that we use. It plugs in and it circulates ice water. It goes home with you. Please make sure you take it home with you. We can use it on shoulders, knees, and hips. It's a wonderful product. It reduces inflammation, reduces swelling, which causes, inflammation causes pain. It reduces nerve irritation. It's very good to reduce pain. It doesn't have any side effects. It doesn't make you nauseous, doesn't constipate you, doesn't drop your blood pressure. It works really well. Pain medications work really well too. If you need them, ask for them. That's why we have them. We want you to be comfortable. If you're not comfortable, you're not going to get up and walk. We need you up and walking. Walking helps prevent blood clots. It helps get that new joint working well. Getting out of bed, physical therapy gets you out of bed the day of surgery. It's kind of scary. We have a few people who cry because it is very frightening because we have this new joint and it's scary. But they're very good at what they do. We have a very good physical therapy team. They're going to come and they teach you how to take care of your new joint. There's many places on the bed to ask for help. On the top of the bed, there is 2 buttons that are nurse call lights on the outside of the bed, and then there's a handheld device that's on a long cord, and then there's another handheld device that's kind of on a bungee cord. If you can't find any of those, yell. We can hear you. Always ask for help. Don't get up without any assistance because we want you to be safe. Sometimes physical therapy will tell you you're good to get up without them. We still want you to ask for help because you still have the SCDs on. You still have a new device in your body and you have pain medications on board. It kind of makes you a little loopy. It impedes your decision making. It impedes your ability to move quickly. We want you to be safe. Always ask for help. This device is called an incentive spirometer. We use it to help prevent pneumonias, another infection. The way to use it is you empty the air out of your lungs, you breathe in, hold it for a second, and let it out. So breathe in, hold it for a second, and let it out. You do it 10 times every hour, 3 times in a row. So don't do it more than 3 times in a row or you get dizzy. It kind of makes you hyperventilate. So every time there's a commercial on TV, if you're a television watcher, is about every 10 minutes. And that's a good time frame. So every time there's a commercial on, pick it up, do it 3 times, put it back down. If you have a visitor, that's part of their job, is to hand it to you every 10 minutes, and that's their job. They help keep you healthy. Another thing we have to help prevent falls is our call lights. When you have your SCDs on, your compression devices, they're connected to the end of the bed. We want to make sure that you stay safe. So always use your call light because these are connected to the end of the bed. You're going to fall if you don't push the call light and you try and get up because you're connected to the end of the bed still. So always use your call light. We don't want any falls. Some of the issues we have after surgery are nausea and vomiting, constipation, anemia, lightheadedness, and that's why we ask that you call for help, because it makes you dizzy. We don't want you to get up, we don't want you to fall. Swelling in your leg, you just had surgery. Sometimes it takes up to 48 hours for that swelling to come up. Sometimes it happens right away. Sometimes the week after surgery, you're going to notice your foot is black and blue. That's very normal. If it gets too bad, call your doctor and let them know. Tell them you're concerned about it. Physical therapy is going to come and see you the day of surgery. We already talked about that. They get you up and get you moving. They teach you how to use that new joint. They teach you how to be safe. They teach you what not to do and what to do. They're going to teach you about that in a little bit. There's exercises that they're going to want you to do. They're going to go through that soon also. Pain control. They teach you some other exercises that help with pain control, some stretching. There's a knee immobilizer that they're going to give you that you come up with surgery. One of the things with the knee immobilizer, sometimes they give you an injection when you have a knee surgery. It's called the nerve block. It goes up here in your thigh and sometimes in the back. Makes your whole leg numb. The issue with that is you have a noodle for a leg until that leg wakes up. The best thing about it, it works really well for pain control. The thing that you have to remember is when you start feeling about to your calf, let me know, let your nurse know, because when it gets to your calf, it wears off very quickly. It hits your knee and it feels like you got hit with a sledgehammer. So the pain hits really quick and really strong. So when you let me know when you can start feeling your calf, I can give you something for your pain and we can keep your pain controlled relatively well. At night, if you have hip surgery, they put, it's called an abductor pillow. It's a big blue wedge. It helps keep you from crossing your legs. That's one of the precautions for a hip. Crossing your legs is a no-no. Occupational therapy will come in and they teach you how to use some of your tools. One of the tools that they give you is this. It's a grabber bar. It helps prevent you from breaking some of your hip precautions. One of your hip precautions is not going greater than 90 degrees, which is this. Can't go greater than this. If you have a piece of paper or the salt shaker on the table and it's across the table from you, if you reach across to get it, you've just broken your 90 degrees. So you want to use your reacher. If you have a piece of paper on the floor, you can pick it up without bending over to break your 90 degrees. Physical therapy will teach about these sooner, and occupational therapy will come and see you and teach you how to use them, how to get dressed, how to shower, how to use the bathroom while you're here so you can go home and you can be safe.
Welcome to Southern Hills Hospital. On behalf of the therapy department, we look forward to working with you and helping you with your joint replacement. My name is Dave Morgan. I'm the manager of therapy services here, and I'm also a physical therapist. For the next 5 minutes, I'm going to tell you some of the things that you should expect from the therapy department in your recovery for your joint replacement. So the first thing I want to talk about is some of the precautions that you're going to have. The first precaution is you shouldn't bend your hip past 90 degrees. The second one, you shouldn't cross your surgical leg over the other one. And the third precaution is you shouldn't be turning your foot on the surgical leg inward, going pigeon-toed. The reason for these precautions is that by doing them, you run the risk of dislocating your hip and having another hip surgery. Also, another precaution is you need to make sure that when you're turning, that you're taking small steps instead of pivoting on that surgical leg. That can also give you the risk of dislocating your leg and causing more pain than you need. We'll go over some exercises that will be helpful for you to do that'll help to prevent blood clots, but also to help strengthen your leg and help enhance your recovery. Now on day one, as Beth pointed out, we will start doing therapy. You'll have your surgery, and within a few hours, the therapist will be in your room getting you up and taking you for your first walk. It's a good idea for you to have a support person with you when you're doing your therapy. That way they can ask questions, they can be there to see how you're doing and know what they can do to help you at home. When you take your first walk, it's important that you get your pain pills first. That'll help increase your ability to do more. The reason that we will be getting you up on the day of surgery and working with you is It'll help your pain control. Also, it'll help your blood pressure regulation and keep you from bottoming out, we call it, where your blood pressure drops and you get lightheaded. Also, it helps your breathing, and it helps you progress quicker and get you back on your feet and back to independence. I'm going to next show you a few things here on the mat table, some exercises that will help prevent blood clots and reduce that risk, as well as some different devices that you can use that'll help you in order to not break your precautions that we talked about earlier. 3 of the most important exercises that you can do after a knee or a hip replacement are ankle pumps, quad sets, that's where you push the knee down and tighten up your quads, and glute sets where you're tightening up your gluteal muscles. Now, when you're doing the ankle pumps, pulling your pants up when you're putting them on, or taking a sock off. Long-handled shoe horn, also the grabber that Beth showed you earlier. We'll also provide you with some elastic strings for your shoes, some shoelaces. These basically will help your shoes to go from being laced shoes to slip-on shoes with these. If you have stairs in your home, the physical therapist will bring you into our gym here and you'll practice on these stairs here going up and down the stairs. There's a right way and a wrong way to do it. The right way to do it is one that'll be less painful and safer for going up and down the stairs. When you're going up the stairs, it's important to go up with the good leg first and then bring the bad leg up to meet it. Good leg first, bad leg, good leg. Now when you're going down the stairs, you'll want to do the opposite. You'll want to go down with the bad leg first while your good leg is bearing your weight. Down with the bad leg first. Now your safety at home is our biggest concern. As therapists, we'll work with you individually on those things that you need to do within your own home to be safe. So we recommend that before you come in and do your surgery that you take an inventory around your house of all those things that might concern you, of how you're going to do those things after your surgery. For example, getting in and out of your car. Is it better to get in and out of the tall car or the short car? The stairs, how to go up and down the stairs. How to get into your bed if it's a very tall bed or a low bed. Take note of these things, and when you come in, talk to your therapist about this, you and your support person, and we can answer all of your questions and make sure that you are safe to go home and that we give you all the tools and knowledge necessary to continue to improve and to be safe.
Nutrition is a huge, huge thing. It helps you get back on track, helps you heal. If you have any special diet needs, let us know. If you're vegetarian, if you follow a kosher diet, let us know so we can make arrangements for you. If you have any special requests, let us know. The kitchen tries really, really hard to accommodate us. If you come up on Wednesday, Thursday, you're going to get a generic tray. If you prefer Raisin Bran for breakfast, let the nurse know. She can put in a special request. If the kitchen has it, they will get it for me. If they don't have it, we can't get it. But otherwise, you're going to get scrambled eggs for breakfast. And we can try and get you what you need. And they work really hard to do it for us. If you're diabetic, let us know. If you're allergic to dyes, those kind of things. They work really, really hard to get us the right products that we need. Good nutrition helps encourage wound healing, helps prevent constipation, helps diabetics heal quicker. So pay attention to your diet. Changing your diet right before surgery is not the best time to do it, but proper nutrition is the key to good health. So we all need to follow a good diet. Discharge planning starts today before you even have your surgery. You want to make sure that your home is ready for you to go home to. So you want to review your home. You want to do things like walk around with a chair in your house and make sure that you can get a chair around your dining room, so you can get through your dining room with a walker, that you can get into your bathroom with a chair and close the bathroom door. You might have to take your bathroom door off for a couple weeks so you can get in and get on the toilet and close the bathroom door. You might have to take the bathroom door off. Sometimes things like that happen. Make sure you have food in your house. Make sure you have somebody to walk your dogs. You're not going to be able to walk your dogs for a few days. Case management will come in and see you the day after your surgery, and they help arrange for home health to come in and see you. That's the organization, and it's nurses and home health aides that help you with your dressing change and help you take care of yourself at home. They also help arrange for physical therapy at home. Physical therapy in the hospital makes recommendations for physical therapy at home. Case management here are nurses who specialize in that, and they work with your insurance company and the surgeon who did your surgery with the specifics that you need. You can use your cell phone here in the hospital. It does not interfere with anything anymore. Your throat might hurt a little bit. That's normal after surgery because you had a tube down your throat during surgery. Visiting hours are not limited on our floor. You can come and visit 24 hours a day, which is good for Las Vegas because we're a 24-hour-a-day town. You'll be in the hospital anywhere from 2 to 4 days, depending on your surgery. Most surgeries with knees and hips are three-day stay, and you go home or to rehab. Most of our patients go home. They do really, really well. We have really good outcomes. Driving. You can drive. It usually depends on your surgeon, but it's usually about 6 weeks. You have to be able to control the car. You have to be able to control the limb that you're going to be driving with, and you cannot be on pain medications. You cannot drive a car while you're on pain medications. The cafeteria is on the bottom floor. Patients cannot go into the cafeteria, but family members can. It's important for them to be able to take care of themselves because they're the ones that are going to be helping take care of the patients. We hope this information has reduced your anxiety for your new joint replacement. Please remember to always wash your hands to reduce your risk for infection. Use your equipment that we provide to reduce your risk for blood clots. Always call for help to reduce your risk for falls. And we look forward to seeing you soon at Southern Hills Hospital. Thank you very much.
I would like to thank you for choosing Southern Hills Hospital, and I hope this education that we're providing will help you feel more comfortable about your upcoming surgery. We look forward to seeing you here soon.